Good morning. Today is National Kidney Day. So I'm coming to you in order to talk to you about kidney disease. And for those of you who don't know me, if you've never heard me or never seen me before, my name is Trinette Stanford, and I'm a nurse practitioner and diabetes and health education specialist. And I have a company called Totally About Diabetes, which is a coaching, education, and support program for people with diabetes, prediabetes, and other related conditions. So, like I said, today is National Kidney Disease Day. And how is that related? You may say, well, okay, kidney disease, diabetes, how is that related? Did you know that diabetes is the number one cause of chronic kidney disease? Uncontrolled blood pressure is the number two cause for uncontrolled blood pressure. So those are the two most prominent reasons for chronic kidney disease. Other conditions that lead to chronic kidney disease fall way under that, and it could be like polycystic kidneys, where there's all kinds of cysts that's formed on the kidneys, and kidney damage, and also could be congenital problems. But today we're going to focus on diabetes and high blood pressure, since those are the most two prominent areas. Now, what exactly do the kidneys do? A lot of times people think, well, I go to the bathroom, I pee okay, but kidneys do so much more than that. One of the functions of the kidney is to filter the blood to remove waste products. As the blood circulates through the kidney, it grabs hold of those waste products in order to accumulate it. Then also it removes extra water from the bloodstream. So the water plus the waste products equals urine. So that is the normal function of the kidneys. So what happens in chronic kidney disease, there may be damage to some of the other structures of the kidneys, where one of the biggest problem is the waste products are not grasped, they're not removed from the body, and those waste products accumulate in the body. And then also some of the other things that happen over time is some of the other functions of the kidney is to help control the blood pressure. There's another structure that sits on top of the kidneys called the adrenal glands, and they help control the blood pressure. So that's another function of the kidneys. So when the kidneys are damaged, that may be when people are unable to get their blood pressure controlled. So who is at risk of developing chronic kidney disease? The demographics that are most common or most prevalent to develop kidney disease: number one, African Americans; number two, American Indians; number three, Hispanics or Latinos. All of these demographics are more apt to develop kidney disease than the Caucasians. And some of the risk factors that contribute to kidney disease: the number one, smoking, because the nicotine in smoke works on the blood vessels and it damages the blood vessels. Uncontrolled blood sugar, increased sodium or salt in the blood. Sedentary lifestyle, that means that you're not active. That is another risk factor. Weight is a risk factor, which goes along with the sedentary lifestyle. Heart disease, and a family medical history of kidney disease. Those are other risk factors that contribute to it. Now, I said diabetes and high blood pressure contribute to kidney disease. Well, what happens is uncontrolled blood sugars, you have increased amount of glucose in the bloodstream, and constant exposure of glucose to those blood vessels will stiffen those blood vessels and cause damage. And the damage to the blood vessels that lead to the kidney causes a problem. And the thing is, the vessels that go to the kidneys we call microvascular. That means there are small vessels. So those small vessels have a tendency to get damaged earlier. They're more prone to damage because of their size. So that's why it's very important that we do all we can in order to improve our health. So some of the symptoms that occur with chronic kidney disease, you know what? It's not many, because just like every other chronic disease, there's not any symptoms. By the time you develop symptoms, you are in the late stages of the disease itself. So swelling can occur, decreased amount of urine can occur, but the number one area where we are able to diagnose kidney disease is through lab work. So that's why I always encourage and I always emphasize to go get regular medical checkups with lab work. You need the labs because those labs are tantamount in order to give you the information that's needed to let you know how your kidney function is. And what happens with the labs, you're able to look at the BUN and the creatinine. Those are two markers that we look at in lab work in order to assess the kidney function. One of them assesses the function of the kidneys, is the creatinine, and the BUN, what that is, it assesses the amount of waste products that's accumulating in the bloodstream. So that's why we look at the two numbers, the creatinine, which assesses the function of the kidneys, and then the BUN, which assesses the amount of waste products. And those two numbers taken together, looking at that, are able to determine the kidney health. And then there's a third lab value we look at, which is the GFR, which looks at the glomerular filtration rate. And what that is, and it's a fancy word to say, it looks at how the kidneys are filtering your blood, and it's on a percentage, just like with heart failure, just like with your heart function. The higher the percentage of your GFR, the better your kidneys are functioning. So usually normal is if your kidneys are functioning greater than 60%, that means your kidneys are functioning well. But when they start going down to 40, 30%, that means that we have some serious issues that's going on that need to be addressed. And we will, and usually dialysis comes in to play when your function is around 15%. But right now we're just going to focus. The purpose of this broadcast is to inform you. So there are things that you can do at home in order to prevent any further decline, all right? To inform you so that way you can go to your medical provider and find out exactly what your kidney function is, what your numbers are, and what you can do in order to improve it. So in order to protect the kidneys, these are things that you can do at home, all right? Number one, keep your blood sugar in control. As much as you can possible, keep your blood sugar in control. That means regular monitoring. That means really sticking to your diabetes meal plan, that you want to eat the right foods, the right amount of foods, the right type of foods in order to keep your blood sugars controlled. Also, you want to keep your blood pressure controlled. Like I said, the number 2 cause of kidney disease is elevated blood pressure. So what you want to do is keep your blood pressure controlled. And how do I do that? Make sure if you're on medication, take your medication as it's prescribed. The other way is to monitor or make sure that you do not have a lot of sodium, which is salt, in your diet. You do not take in a lot of salt. And you said, well, I don't put salt on my food. But the thing is, if you are eating packaged food, if you are eating processed food, a lot of those foods contain a lot of sodium. because the sodium is used as a preservative. So you have to be mindful of the amount of sodium that you eat. So if you're eating packaged foods, prepackaged meals, look at the ingredient label. And you want to look at the sodium content. And what you would like to see is the sodium content 200, 400 milligrams, no more than that per serving, all right? So that's something else that you can do in order to keep your blood pressure controlled. Another thing, which is really tantamount for any chronic disease, quit smoking. If you are a smoker, you need to talk to your provider about getting into a smoking cessation program. Do whatever you need to do in order to quit smoking. And I know smoking is one of the hardest habits to break. I used to smoke, and it was a long time ago, but it was one of the hardest things I ever had to do. So, but it is possible, and like I said, it is vital for your health. Drink water. You want to avoid sugar-sweetened beverages. You want to avoid a lot of different toxins. So you want to drink water as much as possible. The goal for water is 1/2 your body weight in ounces. Unless your doctor has put you on fluid restriction, that is the goal you want to shoot for. 1/2 your body weight in ounces. I don't like the taste of water. You know what? There are things that you can do in order to flavor your water, in order to improve your palate for it, all right? So take your favorite juice and take like 1/4. So if you have an 8-ounce glass, let 1/4. Okay, 2 ounces of your 8-ounce glass, let that be juice, and then fill up the rest of it with water. That will dilute it, but that will give you the flavoring. And as you get accustomed to it, you can use less and less juice, all right? Or you can use lemon, orange, any kind of fruit. You can put fruit in your water, and that water can diffuse through the fruit in order to provide flavor, but you need to drink the water. Also, make sure you take your medicines, your prescriptions as prescribed. Do not try to play your own pharmacist or listen to the people on social media about what they did and you try to do it as far as, well, I was able to stop my medicines and I'm fine. Don't do that, all right? Because that can end up with some serious consequences. So work with your provider. If you're having issues with your medicines, if you're having issues with side effects of your medicines, talk to your provider. But under no circumstances do you stop your medicine unless you are having severe side effects. And I mean like you're swelling, you stop breathing, you have severe itching. You notify your doctor, let them know, and then take it. They will advise you what next steps to take. Exercise. Remember, one of the biggest risk factors is a sedentary lifestyle. So in order to combat that means you need to get up and start moving. I'm not used to moving. That's okay. You can get up, even if you can walk 10 minutes. If you can walk around your house or around outside in your yard or something short until you build it up, because once you get started, it doesn't take long for your body to become accustomed to this movement. So, but the biggest thing is you need to get started, because what happens when you exercise, when you start moving, that increases your blood circulation, that increases your heart rate, it increases your blood circulation. So the more blood circulating around, getting to your vital organs, that will help protect your organs. Also, it delivers oxygen to all parts of your body. So movement is essential. Sleep. It is very important that you get the right amount of sleep every night. That is how your body resets itself. That is nature's rebooting process for your body. So go to bed at a regular time. Recommendation is at least 7 hours of sleep. All right. So get your sleep in order to allow your body to reset and start the healing process. Then the last thing is stress. You want to decrease the amount of stress in your life as much as possible. Some of the things that you can do, if it's something that you can handle, a stressful situation that you can take care of, handle it. If it's something that you can't handle, give it to God. Pray about it and give it to Him, because He's the one who can take care of it, all right? Yes, I said you give it to God and you pray about it, you give it to Him, and it's guaranteed that He will take care of it, because He hears your prayers, all right, no matter what. So this was a teaching in order to inform you about chronic kidney disease. And yes, today is Kidney Health Awareness Day, or Kidney Disease Day. And these were just some quick teaching in order to show you some of the things that you can do in order to improve your health. So do me a favor, like this video, and also subscribe to my channel. I'm building up my YouTube channel, so I need 100 subscribers in order to get my own personalized URL. So do me a favor, like my channel, like this video, and subscribe to the channel. All right, that's what you can do for me. This is Trinette Stanford from Totally About Diabetes, wishing you a good and healthy day. Bye.